Hello and welcome. This video will introduce an alternative nerve physiological model where fascia and nerves work together. This will give a good basis for us to better understand the formulas used in stroke recovery, neuropathic pain, and nerve regeneration. In our integrative model, structured water, fascia and nerves form a single interconnected system. Sensory nerves originate in the fascia, such as from muscle spindles, and they don't simply carry electrical signals. They transmit patterns reflecting the physical and chemical properties of the fascia in space and time. Additionally, fascia functions as an exceptionally sensitive quantum scanner, detecting subtle electromagnetic changes in the surrounding field, often influenced by intention. This is the foundational concept for understanding how fascia can become rigid and lose its ability to interact with the field, leading to chronic pain. Conventional medicine categorizes nerves as sensory, motor, or mixed without fully explaining why this separation exists. Interestingly, pure motor nerves usually exist in places where fine and precise motor movement is necessary, and the motor signal is protected from sensory noise. These are the cranial nerves 3, 4, 6, 11, and 12, which are responsible for fine intellectual movements. In the integrative model, sensory nerves arise in and work together with the fascia, which itself is layered with structured water and capable of sensing holographic patterns from the field. Fascia and cell membranes act as highly sensitive electromagnetic sensors similar to SQUID devices, capable of detecting subtle shifts in intention and free will. This may represent one way through which consciousness interacts with the physical body. For a deeper explanation of the membrane SQUID model, please watch the dedicated video linked at the end of this presentation. Clinically, the holographic nature of movement is evident in conditions like frozen shoulder and phantom limb pain, where fascia and connective tissue system guide and control a movement based on these patterns. We cover these examples in detail in a separate video. Fascia can become stiff for several reasons. Emotional rigidity and chronic stress can lead to liver qi stagnation, which is essentially a membrane rigidity and charge stagnation in the cell membrane, creating persistent fascia tension. Impaired microcirculation can cause blood stasis, which is easy to imagine in Western medicine, resulting in localized frozen fascia areas. Chronic waste accumulation can create phlegm dampness, where excess bulk water and metabolic waste displaces structured water, preventing fascia from maintaining its dynamic state. Clinically, this explains why spastic paralysis presents with fascia rigidity and stiffness during passive movement, while flaccid paralysis occurs when nerve triggers are absent, making movement impossible despite the fascia being pliable. In spastic paralysis, we focus on fascia release and water stabilization, while in flaccid paralysis, we prioritize mitochondrial support, tissue rebuilding, and restoring microcirculation to enable movement initiation. Many clinical conditions illustrate fascia block and field coherence loss, including CRPS, complex regional pain syndrome, myofascial pain syndromes, postoperative transitional pain, nerve entrapment syndromes, post-traumatic pain, frozen shoulder, chronic pelvic pain, referred pain, phantom limb pain, spastic versus flaccid paralysis, Parkinson's disease, and tinnitus. These phenomena cannot be fully explained by the classical electrical nerve conduction model. However, they become clear when viewed through the holographic movement and field sensing system, allowing us to understand why fascia rigidity and pattern disruption can cause persistent pain and movement disorders. CRPS, or complex regional pain syndrome, often develops after minor trauma, such as fracture or casting, yet leads to disproportionate pain and severe movement restriction. Releasing the fascia nerve holographic pattern through movement, acupuncture, fascia therapy, and herbal formulas, we can help restore coherence within the fascia field system, providing relief and restoring function. In frozen shoulder, movement becomes painful even when performed passively because the fascia holographic pattern is frozen. Often, the condition resolves spontaneously when the holographic pattern rebuilds during sleep, movement therapy, or targeted fascia release, allowing the field to re-access the pattern for movement. Phantom limb pain occurs because the holographic pattern of the missing limb remains active in the field. Without physical feedback, the field continues to trigger movement attempts, resulting in pain and unusual sensations. Mirror therapy provides visual input that helps the field close the unresolved holographic pattern, reducing phantom pain. Spastic paralysis can be alleviated through fascia and field release techniques, such as some herbal formulas, acupuncture, and fascia therapy, allowing movement to resume. Flaccid paralysis, by contrast, requires mitochondrial and tissue building therapies like certain herbal formulas, alongside microcirculation support to restore the triggering potential necessary for movement initiation. Parkinson's patients often experience freezing episodes where they cannot initiate movement. These patients frequently have high levels of stress and unresolved trauma in their life, leading to muscle and fascia rigidity that mirrors their rigid belief systems. The field struggles to activate the frozen holographic pattern, resulting in an inability to begin movement. Interestingly, tinnitus often co-occurs with Parkinson's disease and may even be an early sign of its development. When the fascia within the inner ear loses its ability to receive coherent signals from the field, the pattern becomes chaotic and the system begins generating continuous noise, resulting in tinnitus. In herbal medicine, we utilize minerals like calcium carbonate and phosphate to introduce new patterns into disorganized, chaotic, structured water layers, aiding reorganization. We use autophagy-inducing herbs such as ginger to help cleanse the fascia membrane system of metabolic waste, which otherwise contributes to stiffness and pain. Herbs like ginger and ginseng support mitochondrial function, effectively helping to reboot the system and restore coherence within the fascia field network. Chronic pain is often the result of a polluted, distorted fascia, where emotional and physical trauma disrupt water structure and promote waste accumulation. This sets the stage for sterile inflammation, which attempts to digest waste but can further dry and stiffen fascia. While medications can cool this inflammation, they often suppress regenerative processes as well, making true recovery rare. Permanently blocking sensory nerves may stop pain, but also sacrifices critical functions. By temporarily reducing sensory input with techniques like ultrasound-guided nerve blocks, while simultaneously restoring fascia elasticity with herbal medicine and manual therapies, we can preserve essential functions and improve quality of life. We have demonstrated how alternative and integrative medicine views chronic pain within the fascia neural matrix. By combining temporary sensory modulation through targeted injections with herbal formulas that restore fascia scanning and sensing abilities, we may avoid the functional losses associated with permanent nerve blocks. This approach offers a pathway to sustainable pain relief, maintaining movement and preserving quality of life, where respecting the body's natural healing mechanisms.